Hi, good evening, everyone. Yeah, just give me a minute. Just give me a minute. Okay, so let us start with this series. So I'll be teaching you about sutures, anastomosis, lot of things. Just wait, there is some problem with the iPad. It's not getting connected. So I'm just a bit worried about that only. Okay, so good evening, everyone. Let us start with the series. And today I'm going to discuss a very important topic about sutures and anastomosis. So it's always a very important. But before that, let me tell you about the iconic. That we get Unacademy and Prep both at a very competitive price, and you have a lot of things going on at Unacademy. So please do make use of that. And new batches are going to start from the month of March. So do make use of them. So now the next. Okay. The next thing that we start off is, let us start the concept of sutures. Yeah, let us start with the concept of sutures. Now, when we talk about the sutures, the most important thing about suture is to understand what are the types of sutures, and then we'll be doing about the anastomosis also. So sutures. Acha, before that, audio video is clear to everyone. Yeah, is audio video clear? Now there are two types of sutures. We have two types of sutures. Just a minute. Okay. What are the types of sutures? The sutures could be a monofilament. A suture could be a monofilament suture, or a suture could be a braided suture. So we have a monofilament versus braided suture. What do we mean by monofilament? Monofilament means a single fiber. Yeah, a single filament is there. This is what is a monofilament suture. What is a braided suture? Braided suture is multiple braids of thread rolled to form a what? A single suture. This is what is a braided suture. So multiple sutures rolled into one, that is a braided suture. Next is, when we talk about the elasticity, this is less in braided suture, this is more in monofilament suture. Again, if you talk about the tissue trauma, very good evening to everyone. So tissue trauma, this is more in case of braided suture, less in case of monofilament. Why? When you have to pass a suture, which is actually braided, so braided sutures are not as smooth as monofilament. Monofilament will glide easily, but braided sutures, they will always cause resistance and hence tissue trauma. This is again very important thing. Next is, again, sutures. When we talk about the types of sutures, we have different types of sutures based upon their property, whether they are absorbable or whether they are non-absorbable. So let us discuss that very important thing. Sutures on the basis of days of absorption. Days of absorption. But based upon the concept of days of absorption, we have following types of sutures. What are they? The first category is, they are rapidly absorbable. So rapidly absorbable sutures. Now when we are talking about rapidly absorbable sutures, what all do we have to understand? The first in this category, can you take lecture on renal and genital surgery based on Bailey and Love? Yeah, Rahul, I'll take. But see, why Bailey and Love? Bailey and Love is not a standard book as far as the renal system and the urogenital system is concerned. Whatever I teach from Campbell and Walsh. That's the best book that you have to consider for the urogenital system. So Bailey and Love is actually standard very low in when we talk about urogenital system. Even Schwartz, Sebastian in that case. There is only one book, that is Campbell and Walsh. Let us try to understand this. When we talk about rapidly absorbable, we have Cadgut. We have Cadgut, and the days of absorption. What are the days? It is 8 to 15 days. Some book says 7 to 15 days. So let us see. So days of absorption, it is 8 to 15 days. Within 8 to 15 days, it gets absorbed. But today, the true Cadgut is not available. What we use? We use chromic Cadgut. So nowadays, we are using chromic Cadgut. When we talk about chromic Cadgut, 90 days is the days of absorption. Where do we use these? What is the use of these sutures? Yeah, they are used for all surface surgeries. What do you mean by surface surgeries? Let us talk about what are the surface surgeries. Yeah. When you talk about surface surgeries, we have surgeries like circumcision. Yeah, we have surgeries like hydrocelectomy. Also, we use it for appendix. Do you know the endo loop that we use for appendix? If you want to see endo loop, go to my latest video of appendicectomy that I have uploaded today on YouTube. My YouTube channel has that video on appendicectomy. Go there and see. I have loaded a video which is showing you endo loop, and then I have made the loop also. So that was a modified Melzer's, that was a Roder's knot that I have shown there. So endo loop for appendicectomy. We use this chromic Cadgut. Is that clear or no? But both these sutures are monofilament sutures, point number 1. And do you know why it is known as Cadgut? Why it is known as Cadgut? It is known as Cadgut because it is prepared from cattle's gut. And you can say this is prepared from cattle's gut. That is, either you can use buffalo, you can take it from sheep. Now, one more very important thing, chromic Cadgut, it is stored. Why it is very popular in developing countries? It is very popular. Why? It is cheap. The second important thing is it is stored in isopropyl alcohol. Abhi, you came to know now about that I left dams. I left it a lot back now. It's 1.5 years more than that. Okay. Then we have polygalactin 910. Polygalactin 910. So when we talk about polygalactin 910, what is this suture? A very popular suture, but marketed by the name of Vicryl. What is a Vicryl, students? It's a monofilament. No, it's a braided suture. Days of absorption, 60 to 90 days is the days of absorption. And always remember, what is the use? This is ideal for GI anastomosis. So we use it for GI anastomosis. Where do we use it? Yeah. What caliber sutures we use it? We use it 20 or we use 30. So use 20 or 30 for GI anastomosis. Then we also use it for CVD repair or CVD closure. So when we talk about CVD closure or CVD repair, we use this. Again, it was Jipmer which has asked this. What caliber suture we use? 30. 30 is the gauge of the suture. Again, we can use it for bladder repair also. Bladder repair. When we talk about bladder repair, yes, you can use 20 Vicryl. Again, for uterine vault repair, or you can say vaginal vault. So when we do TLH, we need to close the vault. Yeah, you need to close the vault. So what is the suture that we use? Number one. We use Vicryl number 1. So these are the various scenarios where we use Vicryl, and what size Vicryl we use has been asked many a times. So I've told you 20, 30, everything. The next important is, to this Vicryl, we have done a lot of modifications. So one of a Vicryl is antibiotic coated Vicryl. What is that known as? So antibiotic coated polygalactin 910. So antibiotic coated polygalactin 910, that is what is known as Vicryl Rapid. That is marketed by the name of Vicryl Rapid. You know, it is having a lot of names: Vicryl, Trucryl. It depends upon which company you are buying. So Vicryl Rapid, the days of absorption is 7 to 10 days. Within 7 to 10 days, it loses the strength. Within 7 to 10 days, it loses the strength, and complete absorption, complete absorption, this requires how much of time? Complete absorption, anyone? 40 to 45 days. So complete absorption requires 40 to 45 days. Again, what is the use? Where do we use it? Just wait. I told you about the Vicryl Rapid. Okay, sorry. So this is rapidly absorbable Vicryl. Rapidly absorbable Vicryl. Sorry. So rapidly absorbable Vicryl. That is. Where do we use it? Again, for the surface surgeries. Surface surgeries. Then we also have antibiotic coated polygalactin. This is different. So Vicryl Rapid is a rapidly absorbable Vicryl. Antibiotic coated Vicryl. So when we have antibiotic coated Vicryl, that is polygalactin, that is known as Vicryl Plus. So what is Vicryl Plus? Days of absorption 60 to 90 days. Where do you use this? Where do you use this? Answer is, do you know colorectal anastomosis and coloanal anastomosis? They are the site where actually the rate of infection is high, and that is why leak. So remember, this is ideal for colorectal or coloanal anastomosis. Colorectal, coloanal anastomosis. This is where we use antibiotic. What antibiotic is it coated with? What antibiotic is it coated with? It is coated with what? Trichosalan. Trichosalan. So trichosalan is the antibiotic with which it is coated. The next is we have delayed absorbable. We have delayed absorbable Vicryl. When we talk about delayed absorbable Vicryl, absorbable sutures, the first is polyglycapron. Polyglycapron. Can anyone tell me what is this suture? Polyglycapron. The days of absorption. The days. I'll show all the sutures. Don't worry, I have all the sutures with me. So I'll be showing them one by one. Polyglycapron is marketed by the name of monocryl. Monocryl. Students, you have to understand, it's a monofilament. It's a monofilament, and also this is undyed suture. This is undyed. If you see Vicryl, this is violet in color. So this is violet in color. Yeah, this is violet in color. Let us talk about this polyglycapron. When we are talking about polyglycapron, this is known by the name of monocryl. 90 to 120 days. 90 to 120 days is the time for absorption. The second very important thing, where do we use it? Answer is for subcut suturing. So when we are to do a subcut suturing, we are using this. Now where do you use subcutaneous suturing? You know, subcutaneous suturing is a suturing where the suture line is hidden. What do you mean by suture line is hidden? The suture is always undermined below the what? Incision. So this is what is the beauty of this incision, that better cosmesis, and therefore it is used for thyroid surgeries. It is used for thyroid surgery. It is used for breast surgeries. Yeah. It is used for LSCS. So these are the places where we use polyglycapron or monocryl. The next we have is polydiaxone. So what to remember about polydiaxone? What to remember about polydiaxon? When we talk about polydiaxon, this is marketed by the name of PDS. PDS, very good. So PDS, when we talk about, this is a monofilament suture or a braided? It's a monofilament suture, point number one. The second very important point about them is, yes, it's a blue colored suture. It's a blue. And what blue? Prussian blue. It's a Prussian blue suture. Yeah. What are the days of absorption, students? The days. Answer is 180 days. 180 days is the days of absorption. When we talk about the use, yeah, where do we use it? PDS is ideal suture for abdominal closure. So this is ideal suture for abdominal closure. Are you getting this or no? So this is ideal suture for abdominal closure. This is also the suture of choice for gut anastomosis. Suture of choice for gut anastomosis. Just a minute. Okay. So it's for gut anastomosis. It's my favorite basically. Why many surgeons prefer this for gut anastomosis? Because it is smooth to glide. Especially when we are doing pancreatic anastomosis, we prefer to go for this over what? Vikral. Next is we have one more suture which is not one more suture category which is non-absorbable. Non-absorbable. Now when we talk about non-absorbable, the first that we have is polypropylene. When we talk about polypropylene, what do you mean by this polypropylene? What do we mean by this polypropylene? It is proline. It is proline. Do you know proline is a monofilament suture? Point number one. It's a monofilament, non-absorbable, and you know it's a blue colored suture. Now, since it is non-absorbable, hence this category is not applicable. Where do we use it? But this is ideal suture for vascular surgery. For vascular surgery, we require a suture which is non-elastic and non-absorbable. Proline is not having a very good elasticity. I agree that it is a monofilament suture, but yes, it is not a very elastic suture. What is ideal suture for vascular surgery? This is very, very, very important. What is ideal suture? The ideal suture should be non-absorbable, point number one. And not only it should be non-absorbable, it should be non-elastic. So amongst the suture, this is having a near ideal features. Next is, when you're talking about vascular surgery, there are a lot of repairs we do. Yeah. So for peripheral vessels, for peripheral arteries, yeah, we require 6-0. For peripheral arteries, we require 6-0. For arteries of caliber of femoral artery caliber, so for femoral artery like vessels, we require 4-0. For aorta caliber vessels, we require 2-0. For vena cava, we require 5-0 to 6-0. For portal vein repair, we require again 5-0 to 6-0 sutures. They're all very, 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 very important. So this is about the vascular, you can say, surgery. We'll discuss about the vascular anastomosis also. This is very interesting. Just wait for 5-10 minutes and then we'll go to that. So this is about the portal vein. Where else do you use where else do you use proline? Proline, where else do you use? Proline is also the ideal suture for mesh fixation, or you can say hernia repairs. So sometimes you might do a primary repair of the defect. So mesh fixation or hernia repair. Where else can you use this proline? Yes. Where else? It can be used even for the nerve graft repair. So nerve graft repair or a nerve repair. So these are some places where you can confidently use what? Polypropylene. Then we also have one more suture. What is that? Polyamide. And this is again very, very, very important. Polyamide. What is polyamide, students? When we talk about polyamide is a ethylone. It is monofilament. It is black in color. So monofilament, it is black in color. This is known as ethi bond. This is known as ethibond. This is very, very, very important. So it is ethibond. The next important thing that we all have to discuss here is, so monofilament, black, ethibond. The next is, let us talk about the use. The use is, it is used for skin anastomosis. Skin anastomosis. Ethilon, sorry, I'm saying ethilon. Ethibond is different. Ethilon. It is marketed by the name of ethilon Trulon. So skin approximation, this is one. Yeah. Where else do we use it? Where else do we use it? We may also use it for burst abdomen repair. For burst abdomen repair, you can also use this suture. What is ethibond? Ethilon. Next is, I've been talking a lot of ethibond. What is ethibond, students? It is polyethylene. So polyethylene is marketed by the name of ethibond. When we talk about ethibond, this is suture which is preferred for tendon repair. This is for tendon repair. One more important thing, what is the ideal suture for tendon repair? Answer is nylon. Nylon is ideal for tendon repair. This is ideal for tendon repairs. One more very important thing, what about stainless steel? What about stainless steel? Do you know even proline can be used? Even proline can be used for tendon repair. It's a cheaper alternative. Ethibond is a braided suture, but it's very costly also. So we use nylon, and we use stainless steel. Let us move forward. When we talk about stainless steel, what is more important thing about this stainless steel? This is the most inert suture. Are you getting? And very good, we use it for sternotomy closure. So we use it for sternotomy closure. Yeah. So this is about stainless steel. Next, let us talk one or two more important things about this. So this is about the sutures. We have something which is known as tissue glue. What is a tissue glue? This is cyanoacrylate. When you talk about cyanoacrylate or tissue glue, what is so important about this? Let us see. But say this can be used to suture, or you can say this can be used to fuse the skin without suturing. So this is a suture, you can say alternative to suture, cyanoacrylate. Now I'll be showing you some important sutures. Let me show you them one by one. So here, can you see there is something written here? This is a true gut. So this golden or a chrome packing, why this chrome packing or why this packing is there? Because it should easily help you identify what suture it is. So what I will do, I'll open one suture for you. This is a chromic catgut, and I'll show you how a chromic catgut is. I want to show you that it is stored in a media. Which is containing what? Which is containing the isopropyl alcohol. So I have opened it, and very soon you will see. I'll pour it on my hand, so you can see this. Can you see the drops here? So this is a suture. Why this became very popular? Yeah. Okay. Why this is very popular suture? Because this is cheap, and this can be, you can say, sterilized and used again and again. So I'll show you all the sutures one by one. Again, I will show you this suture. This is a standard silk. So there is nothing to know in this. There's a silk. Now, whenever we see any suture, complete information about that suture is written. Like, just see this. This is a silk. Yeah, this is a silk. I'll show you how a silk is. There are a lot of things, lot of information in this picture. Just see what are the information that we have in this picture. Let us see. You have a black braided written, and then you have the types of needle, two needles are drawn. Let us open it and let us find it out what is inside. So there are information. Can you see one metric is written, half circle round body. Can you see double needle, half circle round body, double needle. So let us open it and see whether it is true or no. So there is a suture. There is a suture which is having, can you see, this is 1 metric length. So the standard length is 1 metric length, and then this is what is one needle and this is what is the another needle. So there are 2 needles in this. Now when it comes to this, I will tell you what are the parts of the needle, and then I will move from here. So we have I have all the sutures boxes lined very slowly. Slowly I'll show all of them to you. But now let us try to understand the concept of needle, and I'll show the needle and explain it to you. So I'll show you the needle also and I'll explain the concepts to you. Let us try to understand. When we are talking about the needle, what are the parts of the needle? Yeah. What are the parts of the needle? This is the tip of the needle. This is the tip of the needle. This is the body of the needle. So we have tip of the needle, we have body of the needle, and we have eye of the needle. Can you see, students? The eye in this case is not visible. Eye in this case is not visible. That means eye is embedded. If you see, eye is embedded into the body. So if the eye is embedded into the body, this type of needle, this is known as a swagged eye needle. This is what is known as a swagged eye needle. Are you getting this? Swagged eye. So what is the advantage? The traditional needles used to be something like this. Now when you have a needle like this, and imagine you want to go inside a tissue. So just see what happens, what would happen. So when you are going inside a tissue, it's very easy. It's very easy to manipulate this part, but the eye part was broader than the body. Yeah. Silk is not very costly. 120, I think 120 rupees it is. 120 or 100, something like this. 120, 150 rupees, something like this. But this one, 2 needle is costly. Actually, we use 2 needles, especially we have ordered this specially from the dolphin sutures, because I'm using this for my training. Because in training, lot of students come in laparoscopy. We cannot, in laparoscopy, we don't have to take it out again and again. We take 1 metric length. So we have with one with one, you can say, suture, we can divide it into 2 and use it many times rather than a single needle. So double needle suture is almost 1.8 to 2 times the cost, but yes, it saves a lot of, you can say, work. Anyways, in laparoscopy we use a 2 needle. So this is actually we are using it for a training institute. So I prefer to use because it saves some money, becomes more economical. So if you see, this needle part is okay, but the eye part is going to cause more trauma. So there is increased tissue trauma. There is increased tissue trauma as you enter at the site of entry. At the site of entry. And do you know what is this known as? This is known as a shouldering phenomena. This is known as shouldering phenomena. Shouldering phenomena. And because of this shouldering phenomena, we don't prefer to use the closed eye needle. This is what eye needle? This is a closed eye needle. Now try to understand, instead of this, if you have a swagged eye needle where the eye is embedded, it will go smoothly and come out. Can you see? So this is what is the beauty of this type of, so there is no shouldering. That is what is advantageous. Then when we are talking about the body of the needle, based upon the body, you can have 2 types of needle. You can have traumatic and atraumatic. So atraumatic is a type which is actually round bodied needle. And then we have traumatic. Traumatic is actually, we have cutting body needle. So what do you mean by this cutting body needle and round body needle? Just let us see. And we have a special code also for them. So if you see a needle and you cut halfway, This is what is a round body needle. This is a round body needle. Can you see it's smooth? If you analyze, this is a smooth surface. Smooth surface. If you talk about a taper cut needle, yeah. If you talk about a cutting needle, can you see it is sharp? So this is a cutting needle. So this is a cutting needle. This is a reverse cutting. Why this is a reverse cutting? Why this is a reverse cutting? Because the tip of the triangle is below. Can you see? We can have the cutting needles also. We can have the cutting needle also. When you talk about the cutting needle, this is something like this. The edge is towards the upper side. The triangle is towards the upper side. That is the cutting. So what is the utility? Let us see everything. Let us see everything in this. Okay. Let us. I'll try to explain this concept. Just try to see this needle. I've just zoomed in so that you can see. I've particularly zoomed in so that you can see this. This is a round body needle. This is a round body needle in front of you. Can you see? This is a round body needle. Yeah, this is a round body needle. And we might have a cutting body. Yeah. So I'll show you all the bodies. I'll show you all the bodies. Just try to see this. So just try to appreciate this needle. Okay. Just try to appreciate this needle. The body is sharp or no? Can you see the corners? Can you see the sharp corner? Can you see the sharp corner? So it's not like a smooth round body needle. Try to focus on this needle. Try to focus on this needle. This needle is basically smooth. Can you see? It's basically smooth. And this is what is sharp. Next is try to see this. Try to see this. This is a bigger needle. You'll have a better understanding in this. Can you see the needle? Can you see the needle? It's very sharp and the triangular portion is up. So this is a cutting needle. This is a cutting needle. Can you see? This is cutting needle. Flat on this side and this side is the sharp. Now if you see, the eye is not visible. The eye is not visible. The eye is embedded. Can you see? The eye is embedded. And this is what is known as a swagged eye needle. This is what is very important. Very important. I hope that was clear to everyone. Yeah, that is clear to everyone. You have seen the bit bodies of the needle. Now, what is so important about the body of the needle? Yeah, what is so important about the body? When we talk about the body, based upon the body, we have the use also. We have the use also. Hey, bache, this depends upon what we are using. Sapan, cutting when you have to cut through the sharp tissues, that is cutting. When you have to use a reverse hand, backhand, they are actually reverse cutting. Basically, it is useful in orthopedics. रिवर्स कटिंग ऑर्थोपेडिक में बहुत यूज होती है. जनरल सर्जन्स के लिए कटिंग सिर्फ और सिर्फ स्किन के लिए इट्स यूजफुल फॉर द स्किन पर्पस. बेसिकली वेयर डू वी यूज राउंड बॉडी नीडल्स? वी यूज इट फॉर GIT, GUT, CVS. So we use it for GIT, GUT and CVS. We also use it for peritoneum. We also use it for muscle. So we use it for peritoneum. We use it for muscle. So all the thin delicate structures. Now when we talk about the cutting, where do we use this cutting needle? Where do we use this cutting needle? Let us try to understand. Cutting needle is useful for tendons, for ligaments, for skin. It is useful for eye. Yeah. So tendons, ligament, skin, eye, scalp. Yeah, scalp. Also for aponeurosis. Also for aponeurosis. So these are the places where we are using a cutting needle. We are using a cutting needle. But by seeing the shape of the needle, you can decide everything. Like I'll show you a sample. You can say a sample suture. I'll show you a sample suture. I'll again zoom in that. Just a minute. Okay. Just try to see the suture. Let us try to read out the information provided by the suture. Okay, just see what is written. I'm using green. Okay, just try to read this. What is written? This is auricral. Don't read auricral 910. Read it's a braided coated polygalactin suture. Are you getting this? This is a braided coated polygalactin suture. Each and everything is written. But say the code is also written. The code is 2347DA. It's 147. And can you see? This is the beauty of this. This is having a two types of needle. On one side, it is having a round body needle. On one side, you are having a cutting body needle. Now, what is advantage of these kind of sutures? The biggest advantage of this kind of suture is that you don't require to maintain a different inventory for cutting and for round body. Yeah, like normally we need to maintain a different inventory. Yeah, so cutting alag se, round body alag se. So it's upon you. You want to use cutting, you remove that ends. That end is having the round body needle. You want to use round body, you remove the cutting end needle. So this is what is the beauty of these kinds of suture. Again, the code is also given. The code is also given. Right? Let me show you more sutures. More sutures. See, what is this suture? What is this? Can you see? This is again a variety of suture. Number one, where do you see the gauze? Where do you see the size of the suture? Here it is. You've written, you have seen 1, 0. This is 4 metric. This is 4 metric. That means it's a long suture. Yeah. Can you read the needle? It's a 50 needle, half circle, round body, heavy needle. Round body has a code, a dot with a circle around it. Dot with a circle around it. And this is a loop. What is a loop? Let me tell you about the loop. So let me tell you about the loop. So loop is a suture like this. This is a needle. Okay. Suppose this is a needle. This is a needle. And then you have this as a suture. This is what is a loop. Are you getting? This is a loop. Always remember. So where do we use it? This is the ideal suture that we use. And that's known as mass. Why it is known as mass? Just see. It is having a name mass. What do you mean by the word mass? The mass means because you are using it for en masse closure of the what? Abdominal wall. I'll tell you something about the needle also. I'll tell you something about the needle and shape of the needle, and then we'll discuss everything on that. So when we are talking about the shape of the needle, this is very, 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 very important. Now the shape of needle is decided on the basis of the circle. Yeah. So it is decided on the basis of the circle. So what type of circle does it make? Yeah. So it can be a half circle, it can be 1/4 circle, it can be 2/3 circle, lot of things. So normally this is suppose 1/4 circle. Where do we use 1/4 circle? It is used for eye. It is also used in plastic surgery and vascular surgery for microvascular anastomosis. Remember, we use 10-0 polypropylene suture. So 10-0 proline is ideal suture for microvascular anastomosis. Then remember, we can use half circle. Students, 2/3 circle and half circle, they are the most popular needles. They are most popular for GIT, GUT and CVS. GIT, GUT and CVS. We also have a J-shaped needle. J. Where do you use J? This is for groin. A J-shape. This is a J-shaped needle which we use for groin. So this is used for groin. Then we use a compound curve needle. So what's a compound curve? Where do you use compound curve needle? This is used for eye. Yeah. Then we have an endoski. What is an endoski? This is an endoski. Can you tell me where do we use this endoski? Endoski is ideal for laparoscopic surgeries. Let me tell you the purpose why. If you see this needle, let us take this needle. Let me take a needle in front of you. This is the needle. Now, but if this is the needle, you cannot take it inside. You have something. Okay. You cannot take this. This is very easy to use while doing open suturing, but in laparoscopic suturing we cannot do. Okay. So what we can do, we can actually straighten up this. So ideally you buy, if you want to buy a suture endoski, pre-prepared endoski will cost you around $4 to $5. But ये हम जुगाड़ से भी कर सकते हैं. What is that? You hold the needle. Actually, my assistant thought I will not be showing this thing. So generally we can straighten up the suture. Can you see? We can straighten up the suture so it becomes a ski-like. Can you see? It becomes a ski-like, a ski board-like. Yeah, and this ski board-like suture can be easily it can be dropped inside a port. It can be dropped inside the port and taken into the abdomen, and the suturing is done. So endoski, you can just realign the suture. So simply ₹100 suture, you can remanipulate it and you can use it for. Otherwise, branded laparoscopic surgical instruments are very costly, so sutures have to be costly. So this is what is the basic concept of endoski. Then we have the straight needles also. We have the straight needles. When we talk about the straight needles, where do we use the straight needles? They are used for tendon repairs. They are used for tendon repairs. They are used for CTVS surgeries. CTVS surgeries. Yeah, we can use it for meniscal repair. Meniscal repair. Lot of places we can use it. Do you know we have one more needle which is 5x8 circle. 5x8 circle. Can you imagine this much curvature? So this is like this. 5x8 circle. Always remember the 5x8 circle is designed so that you can rotate this needle inside a closed space easily. Yeah, so you can rotate this needle inside the closed space. This is what is the advantage. So this is ideal for anal procedures, anal surgeries, genitourinary tract surgeries, yeah, nasal cavity surgeries, So this was a basic idea about the sutures and the needles. In the next session, I'll be also teaching you the anastomosis part. So it's a big chapter. Tomorrow again we'll be meeting at the same time. And yes, if you have still not downloaded Unacademy, do download the app, use the code Surgery Live, and start making benefits of the special from the special classes. And also if you're planning to join the plus, use Surgery Live as the code. So I hope you enjoyed. Do share the links with your class. Do comment how you liked about the class in the comment section. And then we meet again tomorrow, taking the chapter